Hi, my name is Sofia Cervantes, and I will be writing my critical assignment on the different types of leadership within the field of physical therapy. I am currently working as a physical therapist for the University of Southern California. My future career goal is to become a physical therapist and a specialist in neurological pediatrics. Many people go through life asking God about their purpose. However, I have found my purpose, and that is to work serving God in the community as a physical therapist. I will be briefly explaining what the profession of physical therapy is. The profession of physical therapy allows professionals to help the community and optimize their quality of life by offering treatment of disease, injury, or deformity. Working in the field of physical therapy entitles clinicians to work close to people and positively impact their life. Also, to make a difference in people's lives in a deeply personal way by helping them get through physical challenges due to disease or injury. Physical therapy and leadership scopes. Transformational leadership is composed of 4 different scopes: idealized influence, inspirational motivation, intellectual stimulation, and individualized consideration. One of the most important scopes within the profession of physical therapy would be inspirational motivation. As for servant leadership, there's also 4 different types of scopes: developing people, humility, interpersonal acceptance, providing direction, and stewardship. Transformational leadership is composed of 2 elements: charisma and emotion. As a physical therapist, emotion and charisma are one of the most important qualities a physical therapist can have. With that said, Lee and Jang stated that women in sports or entrepreneurs have more common characteristics to this kind of leadership. Women tend to focus more on communication, coordination, good interpersonal relationships, and collective success. Communication is one of the most important skills a physical therapist can develop, because when you're working with a patient, communication is key to understand the needs and the wants of a patient to help with their treatment. Transformational leadership also helps inspire patients through stimulation and creative thinking. By this, I mean the therapist will help stimulate the patient's mind to make them forget about their disability or their impairment by creating a fun, creative treatment where the patient forgets about everything and just focuses on getting better. Nurture charisma and respect from a physical therapist can inspire patients to do their exercises and ensure that there's a possibility to recover. As for servant leadership, physical therapists, by using servant leadership, demonstrate qualities of nurture, focusing on the idea of service. Servant leadership, most importantly, helps the profession of physical therapy by reinforcing listening skills, empathy, healing, awareness, persuasion, foresight, stewardship, commitment to the growth of people, and building a community. All of these qualities are very important. However, I think one of the most important ones would be listening. So listening and communication go hand in hand. Communication from transformational leadership and listening from servant leadership. The reason why I think listening will be one of the most important ones are because you want to be able to listen as well as communicating with the patient, but most importantly, listening to their wants and their needs of the patient in order to create an environment that's pleasant and enjoyable for the patient in order for them to have a successful recovery. Some of the ethical issues that physical therapists may face are external pressures from patients' family members or stress and depression from patients. Conflict from patients, family members, or questioning the physical therapist on treatment are some of the main ethical issues that physical therapists face within the field. Therefore, providing direction in using servant leadership, we'll use listening and humility skills to build trust between patient, family member, and provider. By creating a supporting environment for both patients and family members to support their needs and desires. This is where listening skills come into play. When the physical therapist listens to, the concerns and their needs and their desires of the patient or the family member, it allows them to start building that trust, and it will potentially build a relationship between the family member and the provider and the patient and the provider. Another ethical issue that physical therapists may face is depression and stress. Many patients, after suffering a traumatic injury or disease, give up on life. Stress of not being able to walk, move, shower, or eat cause depression in many patients. Think about it. You wake up one day and you're in the hospital and your lower extremities are not able to move, or half of your body is not able to move. This situation happens to many people, unfortunately, and they get frustrated because they're not able to function. They're not able to do their activities, their daily activities, and most of them fall into a depression. By implementing characteristics of transformational leadership, such as charisma and creativeness with treatment, patients target their illness or impairments while they are exercising and respond better to treatment. By motivating a patient and making a treatment fun and creative, it helps give a distraction to the patient while they're in the clinic, and that distraction allows a little bit of a breather where the patient is not thinking about their impairment, just the impairment. They're thinking about, oh, I'm getting better. I'm gonna give it my all so I can possibly recover. So by implementing charisma and motivation and a creative way of treatment, that will help increase the potential of a patient while recovering. In conclusion, some of the strategies I will use to improve as a leader would be: increase trust from patients and team members to improve the vision of treatment, trying to learn and grow from mistakes and capitalize my strengths, identify weaknesses, keeping my integrity as a person whenever a decision has to be made. All of these tie down to keeping my integrity as a person whenever a decision has to be made. I am a Christian woman, and I was raised Christian, and I was taught that all my decisions should be based in a moral and ethical values. With that said, trying to learn and grow from mistakes and capitalize on my strengths and identify my weaknesses will help me become a better person, which in turn will help me serve the Lord better and serve the community better. Tying down what we learned about transformational and servant leadership, trying to get the patient to trust the provider, as well as trying to get the family member to trust the provider, by using both transformational and servant leadership, will help improve the vision of treatment and increase the success rate of recovery of a patient. Thank you.